Hi, thank you for tuning into the Video Vet. I'm Dr. Brad. Today we're going to be talking about Cushing's disease, and specifically we're going to be talking about diagnosing Cushing's disease. There's a video segment in the archive basically of clinical symptoms and pathophysiology, in other words what causes Cushing's disease, but this segment is going to focus on diagnosing. So probably your pet would have the clinical signs of drinking and peeing, maybe a pot-bellied appearance, maybe thin hair coat. Typically your veterinarian would run a basic blood panel, in other words like a chemistry panel, and the most likely finding on that panel would be that one of the liver values called alkaline phosphatase would be significantly elevated, and also sometimes ALT or AST, which are other liver values, would also be elevated. And then that would prompt your veterinarian to choose to do one of these two blood tests. And it's pretty much just personal preference by the veterinarian which test to do. I'm going to start by describing the low dose. This stands for low dose dexamethasone suppression test. So this is what we call a suppression test, meaning that what we would do is we'd have the pet dropped off in the morning at the clinic, and we'd take a resting blood sample from the pet of what's called cortisol. That's the natural produced steroid that is in every mammal's body. So that resting sample would be taken initially, so a blood draw would be taken. Then right after that, the pet would be administered what's called a suppression medicine, and basically that would be a man-made steroid. So basically that steroid would be injected intravenously into the dog's vein. Well, with a normal dog, if the body received artificial steroid, a normal dog's body should have the production of natural steroid suppressed, because it should recognize that steroid came into the body from somewhere. So basically what we do then is we pull subsequent blood samples then at 4 hours post-injection of the suppression medicine and 8 hours post-injection. Then those three samples, the resting blood test, the 4 hour and the 8 hour, are submitted to a commercial lab, and basically what we're looking for is if the pet suppresses, in other words if the resting level is higher than the 4 to 8 hour, that's a positive, that's a negative. But if they don't suppress and they continue to produce steroid even though we gave them artificial steroid, that would be positive. The second test is an ACTH stim test, which is adrenocorticotransmitting hormone, and this is a stim test. So basically what we're doing is we're giving the pet what's called cortisol, cortisone, which is a signaler, and for the adrenal gland, and we're seeing if they're over respond to the stimulus, because pets with Cushing's disease will over respond to that stimulus and produce too much. Now there are pets that fall in the gray zone. There's about 1/3 of pets on average that these two tests will come up undefinitive, meaning there's not a true cut yes or no whether they have Cushing's disease or not. Or if we find out, as I talked in the first discussion, if we find out that we can't prove that they have pituitary disease and we're unsure, then what we'll do is propose that we do an abdominal ultrasound, and then we'll physically look for the presence of an enlarged adrenal gland. And it takes a fairly skilled ultrasonographer to be able to identify an adrenal gland, whether it's enlarged, and so that your vet might have to refer your pet for that ultrasound. Some clinics are equipped and have the expertise to do that. Once the diagnosis of Cushing's is made, then I will go over in another video segment treatment options for Cushing's disease.